So, sir, what's the time span of this process, sir?
Time span of this process depends on the patients. Like you're asking about this day 0 to.
So, not, sir, like from the embryo pickup to, from the oocyte pickup to the embryo transfer.
Okay. If it is fresh transfer, it is just a day of 5 days.
Okay.
So if it is a frozen transfer, the culture day is around 5 to 6 days. Then there will be a pause of 1 month for the patient to recover with all the things. Then they will start HRT cycle. That is what FET cycle is all about. They will prepare the endometrium. That is where the embryo goes and implant. So there is something called luteal phase. So until we attain that endometrium thickness and the proper hormone levels and everything, then we start something called geston, that is progesterone. So once we start that, there is a day 1, day 2, day 3. Depends on the day of embryo. We extend the progesterone sustenance, and on the day 5 or day 6 we transfer the embryos.
So, sir, by the end of the 5th day, you are going to get 3 to 4 embryos.
Yes.
Like, how do you make sure you are going to transfer the best one, sir?
We have something called grading system. So that ensures that the sufficient number of cells, healthy cells, should be there. Considering a blastocyst, we have a expanded stage 1, 2, 3, 4. The 4 is the highly expanded stage. It is like an egg, you can consider. How does an egg comes out? A chick comes out of an egg. Same process goes after the day 5. What happens? The embryos grows inside a shell. That shell is called zona pellucida. So it is something like, in a chicken egg we have egg white. The shell is covered. The white part is the shell. So if the growing chick breaks it and comes out, similarly happens in the blastocyst also. On the day 5 or day 6, what happens? The growing embryo will not have enough space to grow even further. What it will does, it will break the zona pellucida. It will come out of that shell, that is what zona pellucida, and comes an implant.
Sir, usually you are doing 2 embryo transfers at a time. So, is that the reason for the higher chances of twins in IVF process, sir?
Actually, everyone wants success, right? Yeah. Everyone wants to get pregnant. With a single embryo transfer, the possibility is a little bit less. It depends on the other parameters as well. Whether the embryo breaks the shell, goes an implant, there could be a possibility is that the embryos will not be, the hostile environment will not be available. The hostile environment will not be that much apt for an embryo to implant. There is something called implantation window. The time we have transferred, the implantation window will not be there. That implantation window is nothing but their genes are getting expressed, where the embryos goes and bind to that endometrium. There it burrows itself inside the endometrium. There gastrulation, blastulation, everything happens then. That is how it grows. So in a single embryo transfer, there is a less chances. So if we transfer 2, there are possibilities that 2 also can get implanted. So if the 2 gets implanted, that is where the twin pregnancies happens.